We've been very privileged to see 2 surgeries today, one here in Kenya in Mombasa, as Dr. Michael Mwachira just mentioned, as well as in London, and to communicate across 3 different countries. We had Uganda, we had Kenya, and we had London all talking together at the same time. And this is something in Tharaka Nithi, in Makueni, in Wajir, in Garissa, 28 hubs in 13 counties now, thanks to the Council of Governors, Health Committee, and the Surgical Society of Kenya. So welcome everybody. Please come on in. Please do come on in. We're starting the session now. Take a seat. First, I have to thank Director Katra Ali and her incredible team at the Health Services Committee, including Dr. Simon, Paris, Charity, and Jemima. You are people who keep all of this running behind the scenes, and you work tirelessly day and night. We recognize you for all of the work to make this happen. When I look around this room, I see what truly matters. It's you, because each person in this room is precious. Today, we're putting surgery front and center, and the surgeons and teams here in the front row. This is why we do what we do. In a moment, you will hear about digital surgery and why it matters. But here's the truth. One day, each of us, or someone we desperately love, will need surgery. In that most vulnerable moment, it will be these people in the front row right here who are going to be meeting you in your most vulnerable moment, giving you the care that you need, and fighting for your life. Our mission is to ensure that they are fully equipped to serve you when you need it the most. Kenya's flag carries the word "I love most," and you're all going to roll your eyes because it's got a political connotation to it, I know, but just go with me for a second. Harambe. Pulling together. For me as an outsider, it means everything. From Makueni to Garissa, Homa Bay to Kisumu, I've seen surgeons serve late into the night. Dr. Muthoka, when you arrived here, you had just spent 8 hours in a neurosurgery in Makueni County. You came with your eyes bloodshot to the airport. You served your citizens well. You are the reason we do what we do. Yeah, please clap. They deserve it because most of the time they're not seen, they're not heard. They just do what they do because they love the citizens and they love surgery. So they are the best of humankind. So this session is not about us talking at you. As you've seen earlier, it's about you talking with us. It's about all of us pulling together, and as John F. Kennedy once said, we all know this very well, ask not what your country can do for you, ask what you can do for your country. Your surgeons, your clinicians, and innovators in this room are your future. They are that statement in living, breathing reality. Stanley, Caesar, Dr. Ali, Dr. Jihia, Dr. Mike, Dr. Muthoka.
So we have embraced technology, and it has cut our, of course, HR costs, because you can't have experienced surgeons in every particular hospital. And I'm glad that out of what is happening, they're able to skill one another and be able, at Makueni County, they're able to give direction, the senior surgeons giving direction to the other surgeons. And it is truly has worked for us. One of our, Dr. Doris Mbidi, she's one of the obstetric gynecologists. And I know she has done lots of surgeries, and I always, His Excellency Governor Mutula always speaks about what he has been able to go and observe during the surgeries being done. Of course, I must, take note of Dr. Muthoka, again, the neurosurgeons, and not saying others are not doing their work, but I must take note of that, because we're glad that we're able to do, I don't know what you removed from someone's head, but we are grateful.
I stand here with a lot of gratitude, definitely, to be among the counties that have benefited from the Proximie in terms of having this technology installed in one of my hospitals. But I also stand here as the chair of Health of Council of Governors, and to take stock of the good technology that is, or innovation that is working in a few counties. And I'll definitely be an ambassador for you and an advocate when we are meeting as a Council of Governors, right from the Health Committee to the full council, because if technology is working, we should spread the good news. We should spread the technology, because unlike us who have counties, our patients have no boundaries. They choose where to go depending where they can be assisted. We could be talking about technology working today in Makueni, but their patients of Makueni would prefer to go to Kajiado because of the distance. We could be having patients in Tharaka Nithi County who would prefer to go to Meru and Embu because of the distance. And therefore, we talk about the patient space that has no boundaries, because that is how our population is like. We are not confined to our counties when it comes to our medical needs. I'm not a medic, and therefore I may not be having a lot of knowledge on the technologies that we have, but I have an understanding what it can do for our people, both in our county and in Kenya. For one, we are a country that is not as advanced as our funders, or rather our sponsors, the British and your other partners, because one of the biggest issues that we do have as counties is a lot of needs, but with minimal resources to meet those needs. And one of the biggest needs that has been alluded by the Deputy Governor of Makueni is the HR who are qualified to be able to do surgery. When I make advertisement and I need a surgeon, I usually get 3 times or 4 times of the numbers that I need. Yet I'm not able to employ all of them because I have limited resources. So if technology has come that can be able to assist us have assistance outside the county by having telesurgery or telemedicine, that is a technology that a lot of us will embrace.
All of us at some point will go through. Who here has had surgery? I've had surgery myself. Okay. Who knows a relative who's had surgery? Okay. Who knows a friend who's had surgery? See, almost everyone. So surgery is part of our lives. And I think until you become a patient and you go under the knife, or you take a loved one, then these realities sink closer. While primary healthcare and non-communicable diseases often dominate our health agendas, surgery is essential to a functioning health system. And I think you've seen why. Surgery addresses life-saving emergencies. We've talked about obstetric emergencies, trauma. Last week we were this morning with the governor for Kisumu, and he was telling us about the bus accident that they had in Kisumu town. Cancer. You've just seen a case for a patient who had abdominal cancer. We also know that globally, 5 billion people lack access to safe and affordable surgical care, and therefore delays or lack of surgery contribute significantly to preventable death and disability. So the goal is that when surgery is needed, we ensure that our surgeons and the teams that are fully equipped to serve these patients are there.
It's a genuine pleasure to join you today in Homer Bay County at this brilliant conference. I have to say I went to the last one in Eldoret, and this one just seems bigger, like really big, right? And it's been great. I have met so many really interesting people, and you should all be so proud of what you do. So it's been lovely to join you, if only for a very short time. So I just wanted to say that you will hear a lot and you will see a lot, perhaps a little bit more than some of you bargained for when you walked in, about the incredible technology that is being applied here. But actually, really, what this technology is about people. And I think Dr. Ali's story that he will tell you a bit later is actually, it's quite easy to get a bit carried away with all the gadgets and the sort of clever connections, but it's about people. It's not just about the surgeons, it's also about the patients. And I think that's what's been really inspiring for me over the last couple of days when I've met with the surgeons and with the Proximie team, is that they're all so passionate about this. And it's not really about them, it's about a system and it's about the people. And I think we could really celebrate how that technology and that collaboration and the trust that it requires in this system can transform healthcare delivery. And as we've seen, that can be in remote areas. Surgery, as we've heard from the Deputy Governor from Makueni and from surgeons themselves is not often discussed. And it's fundamental, though, to a functioning health system, as many of you will know yourselves. And yet we can see here in Kenya that many people are several hours from a surgical facility. And as His Excellency Governor from just spoke about, rural counties continue to face challenges in staffing and in equipment and in technical support and mentorship.
Let me orient you. This is now my dashboard, Dr. Nji here. And the cameras, as Dr. Mwachiro was explaining, you have a camera that looks at the room. So you can always see who are all these people, who are these layabouts in the room, who isn't earning their salary, things like that. Then there's the camera on top of the operating table. And now for the surgeons, this is what's important, because a surgeon dialing in can look and say, are you putting your instruments in the right place? And then this is the view of inside. Now, here's an interesting thing. When we went in, this is a lady who'd had recurrent bouts of cholecystitis. Her gallbladder was inflamed. And that happens when there are stones in the gallbladder. And here's what they hadn't told us before. She'd had multiple other surgeries. And so what happens is the same way you scar on your skin is the same way you scar inside. And so she had a lot of scars. So here's the thing. The first camera we put is here near the umbilicus for the video. And a lot of the time, we need to put another port there. But as you can see from our view inside, everything is stuck. And so after we'd put this port and these two other ports, I called my colleague in Nairobi, called Dr. Hussein, and I said, Dr. Hussein, I don't think we can finish this surgery using the camera. We'll need to do the old school one. And now, because Dr. Hussein is a bit braver than me, he said, what do you mean? I said, go ahead and try and finish it using the camera. And so with that, I got confidence. I said, someone in my ear has said, go ahead. And so what you can see us doing is releasing the gallbladder slowly. We were able to release. Remember we talked about advanced energy? The two scissors now. Now this is different. Remember the other one was using ultrasound, vibrating. This one sends between those two jaws, there's electricity and it just burns between those two jaws. So it's safer than just going in with energy. We call it monopolar, bipolar, but the energy is just between those two jaws and allows us to divide tissues. Again, same with cancer. Remember in cancer, the cells go and say, oh, I'm attaching here, and blood vessels come where they shouldn't be. The same thing with scarring. When tissue scars, there's a lot of bleeding. And so what you can see, this allows us to buzz, seal all the vessels that might actually leak, and then push away. And that's what we are doing.
Through platforms like Proximie, experienced surgeons can share their expertise with junior colleagues remotely without incurring the cost of disruptions of physical travel. With only the cost of internet connectivity now increasingly accessible, this model has proven most cost-effective and scalable. The results we speak about for themselves. In Makueni County, for example, I was sitting next to my sister there and we were chatting, and she said they have this thing in Makueni County. In Makueni County, an 82% efficiency improvement was recorded in surgical care following the adoption of digital tools under the Safe Surgery Program. Counties such as Tharaka Nithi, Homa Bay, and most recently Garissa have launched similar technology-enabled surgical hubs, powered by remote collaboration platforms and cloud-based solutions. These successes are made possible by strong partnership between county leadership, innovators, and professional societies. Next time this speech is written, Kisumu will be one of those counties that should be mentioned. As county governments, we continue to grapple with systematic challenges: a shortage of specialists, limited training capacity, and significant inequities in rural surgical access. We therefore require sustainable and scalable solutions. Successful digitization must be patient-centered, integrated into health systems, and supported by long-term commitment at every level. Let me repeat. Successful digitization must be patient-centered, integrated into health systems, and supported by long-term commitment at every level. Ladies and gentlemen, Proximie is one such solution. It is a secure, real-time surgical collaboration platform that allows surgeons, mentors, and trainees to observe, listen, and interact during live procedures regardless of geography. Proximie's continued presence, working alongside our counties to troubleshoot, adapt, and grow, is the kind of partnership we must champion. Just last week, a surgeon at Coast General Hospital virtually consulted on a neurosurgical case being conducted in Makueni without leaving his operating theater. Makofi basi. This is the future of our healthcare system: seamless, real-time collaboration across counties. This initiative also helps address one of our greatest barriers. That is, the reality that our health workforce often cannot leave their own facilities to train others. With digital surgery, mentorship and consultation are now consistent, live, and accessible. In other words, given some kind of shortage of human resources at very high levels, this kind of technology helps to bridge that gap. Mabwana na mabibi na wale wasio na mabibi, as chair of the Council of Governors Health Committee, I remain committed to ensuring that no county is left behind. Sharing infrastructure, aligning with national policies, embedding digital tools in budgets, and partnering with professional bodies. Innovation without sustainability is just a headline. Counties need stable financing, infrastructure, and continuous training to make these gains permanent. It is our responsibility, ladies and gentlemen, as duty bearers, to take the next steps to consider how we co-create the enabling environment for such programs to scale across all counties and support our surgical teams and workforce to access the training, the mentorship, and support they deserve by making surgery a fundamental priority of our health system's policy and agenda. As I conclude, and as I must conclude, digital health is not about technology alone. It is about equity, access, and dignity. With the right tools and partnerships, county governments can lead a transformation, not just in surgical care, but in the entire healthcare system, grounded in connectivity, shared expertise, and trust. Together, let us ensure that no Kenyan is left behind, no matter where they live. Let us connect our healthcare providers, equip our facilities, and build a future where every citizen can access care, safe, timely, and expert care. Asanteni sana. Mungu awabariki.